So I saw this question asked in a forum a little while ago, and I'm actually a little surprised that this is still a thing, because I heard about this years ago, and that's this concept of giving a nursing dose. So in this video, I'm going to talk about what a nursing dose is, some of the other interesting names it has, and why this is in general really bad practice and you shouldn't be doing it. But before I get to that though, I want to go ahead and invite you to hit that subscribe button if you're not already subscribed. On this channel, I'll talk about all things related to nursing student and nurse life. And also, if you are looking for a job, I just want to kind of put a plug in for the job board over there at NurseMoneyTalk.com/jobs. Let's go ahead and get right down to it what exactly a nurse dose is. Now, I've seen this called a couple of different names. So nurse dose, nurse dose, nursing dose. I've heard some nurses call it a Christian dose. I don't know why. That was just what I've heard. A couple of nurses, called it, years ago. So that is, what it is. And so, but in essence, a nursing dose is when a nurse gives an extra dose of a medication. So this, a lot of times you're probably looking at narcotics or maybe with psych medications or whatever, if they determine that the amount the physician ordered is not adequate. So why do nurses give nursing doses? So, sometimes like a nurse will give it if they feel like the pain medications that was ordered is not enough for a patient who's having severe pain. Sometimes you might, I've heard situations of like, it happening in mental health facility, when, if the medication that you have a patient that's kind of getting aggressive, violent, belligerent, whatever the case may be, and the medications that the psychiatrist ordered, the nurse doesn't feel like it's enough. And so I've seen that happen. I've heard situations of, nurses doing this when they're not trying to wake up doctors, regardless of the reasons why a nurse would do it. Like this is just bad practice for a couple of reasons. So the first reason why it's bad practice is you're practicing medicine without a license. To me, this is the obvious issue with this, is that you're neither a physician nor an advanced practice nurse, so you can't arbitrarily make up your own orders. You just can't do that. That's obviously outside your scope of practice. And the other big issue with this is that you're not documenting what you're giving, because that's kind of the whole point. You were ordered this, you put in ordered for this. If you had a situation where like the physician ordered morphine 1 milligrams, your facility order comes in 2 milligram vial, and so you're supposed to give 0.5 mils, which would be 1 milligram, but then you decide that you're just going to give the 1.5 milligrams. That may or may not seem to you like it's a big deal, but it starts becoming a big deal if a bunch of people are doing this and it's not being documented. The third, and probably the leading, the outcome or what ends up happening because of this, is you have a chance for potentially bad patient outcome, because once again, now you have medications happening and medications being given to patients and stuff happening that's not adequately being documented. And so this is just in general just a bad practice, and you shouldn't do it. If that's, I think it goes without saying, if it gets discovered you're doing it, you're gonna have you're gonna have probably severe punishment, penalties, probably reported to the Board of Nursing, possibly written up if not fired as well. So just don't do it. Now, if you are in a situation where like you feel like something like a patient needs more medication, there are certain avenues you can go instead. The obvious one is to call call the physician. This doesn't matter whether it's at 3 a.m. or 3 p.m. or whatever. it is their job to assist in treating the patient. I mean, that's just what it is. If you get to a point where you've talked to a physician and you're not getting, you're not getting the response that you feel like is most adequate for the patient, then this is situations where you need to kind of move it up the chain of command. Talk to your manager, talk to your treatment team, whatever it is your facility protocol is, then you just need to make sure that you're following it. I mean, guys, you've worked really, really hard for your nursing license. You've went through, you did all the prereqs, went through nursing school, and, did all of that crap to get your nursing license. Please, please, please don't be so quick to potentially throw it out the windows.